Some women don't choose to breastfeed because they know they have to go back to work right away. But it is possible to pump and successfully give a baby breast milk over a long period of time. I myself have seen 2 of my daughters pump for their babies who had to go back to work at 12 weeks, continue to give their babies breast milk through 6 months of life with the wonderful technology that's out here and the knowledge that they knew breastfeeding was really the best thing they could do for both themselves and their babies. A piece of advice that I would give pregnant mothers who are planning on breastfeeding is to talk to your employer ahead of time. Do some pre-planning. Find out, has anybody breastfed at the office already? You might want to check out a place where that would be appropriate to either breastfeed or pump at work. And it would be good to talk to the Human Resource Department and see if there are any policies currently in place that could assist you with that, because breastfeeding is really best for a mom and a baby. Breastfeeding is very important for a baby and a mom and has many, many benefits that both can receive from that. Technology and new breastfeeding products have really helped moms to successfully breastfeed. There's a number of pumps out there, a bunch of storage techniques that weren't there years ago, and really supports breastfeeding. But on the other hand, we have to be sure that technology also supports safe and healthy birth. We wouldn't want routine use of technology in labor without there being a reason for that. We wouldn't want unnecessary cesarean sections, and so we have to be smart with technology. We live at a wonderful time when many options are available. Well, it's important to know that the Affordable Care Act supports breastfeeding in the workplace, and larger employers have to assure a place where women can breastfeed and/or pump when they are breastfeeding moms. It's also important for health insurance and the governments to support childbirth education, because education helps moms to have safe and healthy birth and then supports breastfeeding, which is recommended to be at least 12 months by pediatricians, and most women do not have 12 months off of work. They're returning to work 6 weeks to 12 weeks after the birth of their baby. So supporting that would really enhance the health of both moms and babies. Well, a mom and a baby have to have a safe and healthy birth first to initiate breastfeeding. We at Lamaze look at 6 healthy birth practices that make for safe and healthy birth. For example, one is let labor begin on its own. Sometimes the process of induction can interfere with the hormones that a woman needs to breastfeed her baby immediately after delivery. And it's important that people are informed so that they can make good decisions about their birth and about their babies. And education makes a difference when making decisions about interventions. Breastfeeding can positively affect stress levels. Newborns and moms are under a lot of stress at first. Their bodies are getting used to each other. But breastfeeding helps a woman to secrete oxytocin, which is the attachment hormone. It also helps her uterus to contract, and it has many positive effects for the babies because breast milk is the perfect food for babies. It is digested very, very easily. It's really important that a woman select the right childbirth education class for herself and her partner. A pregnant mom should look at what preparation has her childbirth educator had. She should also look at class size. How big is it? Is it 6 couples or is it 600 couples? She should also look for someone that she feels comfortable asking any and all questions to, and she should also see what sort of certification or preparation has that childbirth educator had. Can she connect? Can she feel comfortable? Because a good childbirth educator and mom personalize their questions and answers to each other so that a mom can make good decisions for safe and healthy birth of her baby.